Well, we develop close relationships to our patients. I think early on in practice, I was trying to perfect technique to give a patient a good outcome, but it became apparent that it takes more than an operation to help a patient feel restored, feel whole, and feel well after a mastectomy. This is a complicated imposition on a patient. It affects the sense of femininity and motherliness and sensuality, and so you can't restore all those feelings and a sense of confidence for a woman in herself and with her partner and with her family just by an operation. And so we've developed a program of support that begins on the very first day of consultation, where each patient gets assessed for what their worries and their concerns are.
When patients come in for the initial consultation, there's frequently other women that are at various stages of post-operative recovery that I'm seeing. And we now have what we call the patient-to-patient caring team. So these women that are maybe a week out, maybe a month out, maybe a year out, maybe in the room right across the hall from a woman that's newly diagnosed, that's overwhelmed with the decisions that she's facing. And this is where they step in. You know, they can come in and show them what they look like.
More often they're part of the sisterhood of support, the group support of women that are matched based on the type of surgery they've had or their age, and they help each other really through the healing process.
The uplifting event, the term uplifting is obvious in this context. It started out small, to where women can come and we can have maybe they can work with a makeup artist as an uplifting experience. They can perhaps meet with a bra fitter after their reconstruction. And it'll be sort of a social gathering. And we started out small, but it was quite a hit with the patients, and we realized that there's tremendous potential there for a sense of camaraderie, you know, with and between the patients and with us. To the point where last year it was over 100 women, and we had, it was a party. It was really a raucous party. But I think it's something now that patients look forward to every year.
Oh my goodness, this is where hope begins. It really and truly does. I can't imagine women who go to doctors, get reconstruction, and then they're let go. This is our support. This is what takes us on our journey, which heals us both emotionally and physically.
Absolutely found a community of hope here. Coming to the groups are just, you have a connection with people.
It's the doctors who are so respectful of their patients. It's the PAs who are just so respectful, and it's a philosophy, it's a culture, and it's people who really love working with and helping people to move towards healing in a real and authentic way, not patch them up and move them out. And I think that's what's so extraordinary about this practice.